We're very pleased to have everybody here today. This is a presentation of the E-Club of Atlantic Northeast Information, and we're proud to have as our guest tonight Harvey, who's going to be talking to us about some really interesting things to know for all of us about gender in general and some things in specific. If you are interested in Zonta at all, please make sure and let us know. We would be happy to follow up with you. Thank you. Enjoy the presentation. Harvey?
Okay to jump in? Okay, great. Thank you all. Thank you for being here and thank you for inviting me. I had a wonderful time at the meeting in March in Concord, the Zonta meeting, so I'm really excited to be back and meet some new folks as well. That conversation was in person. This one is obviously on Zoom, which makes it much more accessible, and I appreciate that. And of course, there will be some tweaks and some changes that I do just because it's online. But I will be sharing my screen a few times just to talk about some resources, and then there will be a bigger set of resources available after the presentation if folks are interested in that. So I'm just going to tell you a little bit about my professional background, my work, and then in a little while I'll talk more about my personal story, but I want to just talk for a minute about who I am in my professional life. I'm a licensed clinical mental health counselor here in Concord, New Hampshire, the state of New Hampshire. I own a psychotherapy practice right here in town, and I've been in private practice for about 5 years, 5 or 6 years, and that has been really wonderful to be able to do. I work primarily with the LGBTQIA+ community broadly, not exclusively, but certainly primarily. And I have a clinical specialty in working with transgender youth, gender diverse youth, and their families. So that's really what I specialize in, and that's really the majority of my practice is trans kids, gender diverse kids, and their families, who are a big part of treatment and a big part of the work that I do. I'm a co-founder of the Gender Diverse Care Coalition of New Hampshire, which is a loosely affiliated, fluid group of professionals across specialties, but basically health professionals who get together and share resources, advocate for the trans community, do trainings, all kinds of things like that. And our mission and our goal with the Care Coalition is to increase access to gender affirming care in the state of New Hampshire, and some of the edges too along Vermont and Maine and Massachusetts. And I will talk more about, if you'd like, I can talk more about what gender affirming care is, but that is something I'm part of. I also do quite a bit of work with Dartmouth in various ways, their pediatric endocrinology office and some other places there. So that's me professionally. I've been in my life a camp counselor, a teacher, a dean of students, a clinical supervisor, many roles. But the thing that all of my jobs have had in common is that I've always worked with kids and always worked with families since the very beginning of my career. So in various ways, not always clinically, but always working with kids and always working with families. Just to talk a little bit more about tonight, when I speak to audiences, even over Zoom, and I think even especially over Zoom, because we're kind of all a captive audience here together, we're very close together in some ways. Zoom does that. I always emphasize that I want you to ask any questions you may have. And my most favorite speaking engagements are ones with a lot of discussion and back and forth. So it's not an empty offer. I really do invite you to ask a question. If you want to raise your hand in the chat, in the Zoom thing that lets you do that, you can do that. If you want to just unmute yourself, I'm pretty fluid with those things, and I feel comfortable if you just want to ask anything that you need to ask or make a comment. If anybody has a better idea for how to do that in a more systematic way, that's fine. But I'm pretty open to just you all sharing what you need to share. There will be dedicated space for questions at the end of our time together. But I also, again, want to invite you to ask and engage as we go as well. I'll do my best to answer everything I can. And if I can't answer your question, if it's out of my scope of practice or knowledge, I'll find you the resource that can answer it. Okay. So that is an invitation from me to you. And if you feel nervous about your question or unsure how to ask it, you're not really sure about the language or how to say what you want to say, I get it. But I just want to invite you to be curious, open, and know that overall it's okay to try. If you fumble with something or the language isn't exactly maybe what you wanted to say, or the term doesn't come to you right away, I can help you out. And I just want to open this up as a space for learning. And the only way we can learn, as you all know, I think, is to make mistakes, right? To figure this out through doing. And so I just want you to know that this is a safe space to do that. I promise I am difficult, very nearly impossible to offend. I don't know. No one's ever been able to. So I don't know that this group would be up to it. So I don't think you all could offend me. And I just want to use the space as a way for you to practice and use the most accurate, kind language to talk about gender diverse and trans people. But again, sometimes to do that, we have to go through a process of learning and understanding. Okay, so that's kind of all the framework and background and how I would like this to go. And I'm reading from notes I have in front of me, and then I'll also be pivoting to the share screen in a few minutes. So a big part of my time is spent training and supporting people and becoming more comfortable and ultimately more affirmative in the ways they think about transgender people and gender as a concept overall. So I train clinicians and just anybody, any organization who wants to know more. The phrase affirmative or gender affirmative has been used a lot. If you can raise your hand, or just if you don't want to, but how many people have heard that phrase before? The idea of gender affirmative. Okay, so there's people familiar with it. That's great. And if you haven't, no problem. We're going to talk about it. When we say gender affirmative, when I say gender affirmative, here's what I mean. I mean that when someone, a youth or a client or somebody says to me, I'm trans, I think I might be trans, or I am trans, I just believe them, right? When they tell me who they are. There's no way for me to, and I'm glad about this, there's no blood test, there's no CAT scan or MRI that can show us somebody's gender. And I'm glad about that. Gender is a subjective experience. It's who we understand ourselves to be. And so when people tell me who they are, I just start with believing them. And that is one part of being affirmative. When cisgender people, so when I use the term cisgender, I mean not transgender people. When cisgender people tell us their gender, we don't challenge that, right? So if somebody says, I know I'm a cisgender woman, or I know I'm a cisgender man, we don't usually say like, but are you sure? Or maybe you should go to therapy to figure that out. Or are you cisgender because your parents got divorced? Which are all things I hear, right? All the time. And the truth is we don't do that because nobody's gender comes out of adverse experience. Nobody's gender comes out of something bad that's happened to them, or it just happens. It just is what it is. So that's one way that I practice gender affirmative care. And you can do it too, even if you're not a therapist or, not working with folks the way I work with folks. When people tell you who they are, invite you in to know that, the best thing you can do is just to believe them. Gender affirmative also means we don't see any innate pathology in transgender identity. So there's nothing innately wrong or bad about being trans, right? Just like there's nothing innately wrong or bad about being not trans. There are health disparities, right? There are things that trans people go through at higher rates than non-trans people, primarily anxiety and depression. But that is not as a result of being trans. That's generally as a result of how people treat trans people in our culture, in our world. So in order to be affirmative, which is, I think it is the best way to be, we have to remove or challenge our own beliefs around, is there anything bad or wrong essentially about being transgender? And I would say certainly not. My work is in helping people understand that. And so that's another example of being affirmative. We are beginning as a culture to better acknowledge things like neurodiversity, racial diversity, size diversity. And so gender diversity can also be and should also be something that we are acknowledging as just a natural diversity in the world, and one that helps us, right, is a benefit to us to be and live in a diverse world and culture. Gender affirmative care also suggests that, and I think I've said this, but I'll say it again, just in a little bit of a different way, that health disparities like anxiety, depression, even suicidality come from this big idea of minority stress. So the stress of having a minoritized identity in the world results in these health disparities, not essentially being trans or being a diverse person in the world, but essentially minority stress. How we treat each other is where the stress comes from. And I'm going to screen share. So let's see if I can do two things at once. While I'm pulling that up, I want to invite, just for the first time, any questions or thoughts that anybody has just on what I've just talked about, which by itself could be a whole graduate seminar. So it's a lot. Anybody have any questions or
I do.
thoughts about anything? Sure.
What is cisgender again?
Sure. So you're reading my mind. So cisgender, and we're going to go down here, is a person whose gender identity and sex assigned at birth align in a traditional sense. So, for example, a man assigned a male sex at birth. So someone who is assigned male at birth, and I'll talk about this in a minute, and also understands themselves to be male is cisgender. Make sense?
Yes.
So cisgender, the prefix cis, if any of you have taken Latin, means on the same side of.
Okay.
This is like one way my few years of Latin was helpful to me. On the same side of. So when gender and sex align or are on the same side, right? Someone is cisgender. When they are not on the same side, they're not aligned, then we're talking about transgender, which is a big umbrella term, and lots of things can fall underneath it. But that's a great question. Thank you.
Okay.
Other questions before we get into some of these more specific things? Okay. So I want to talk about this document that I use fairly often. It's from Harvard Medical School, their Sexual and Gender Minority Health Equity Initiative. That's a mouthful. That's at the top. But I find it very helpful in talking about some of these really fundamental and foundational concepts in gender. So we have gender identity. I'm going to start in the middle. We have gender identity, and then on either side, we have sexual orientation and sex development. So I want to talk about gender identity first. What the document tells us is it is a person's inner sense of being a woman, a man, another gender, or having no gender at all. Gender identity does not necessarily align with the sex a person is assigned at birth. And at birth, people are typically assigned one or the other, either assigned male or female. And gender identity might change for some people over time, over the course of their life. And I want to talk a little about what it means to be assigned at birth. Anybody have an idea about how those assignments are made? Anybody remember back to when they were born? No. Or if you've been a gestational parent or there when a baby comes into the world, there's a very specific set of criteria that's used for gender assignment. Anybody know what that is?
Genitalia?
Exactly. I was going to say anatomy, but you're right. It's the same thing, right? It's genitalia or anatomy. And it's important to say that it's external anatomy. So what can be seen is how we are assigned at birth. Nothing else, right? That's it. That's how we get assigned. And mostly that's correct. I mean, we can see by population and just the world that most people are cisgender. That is true. There are fewer trans people in the world than cisgender people, though I think there are more trans people in the world than we realize there are, but maybe still fewer. So generally that works, right? That kind of, we look at anatomy or genitalia, or the doctor says, this is a boy or this is a girl. And generally that lines up, but for some of us, it doesn't. And we're going to talk more about what that means when that happens. I want to talk about sexual orientation as very separate from gender identity. I think sometimes these can feel confusing or feel like the same thing, that when someone's talking about their gender identity, they're also talking about their sexual orientation, but these are very different things. Sexual orientation develops as in kind of, not the same way, but develops in a person as a as a result of nature, nurture, environment, also things that might be innate to them. And it is essentially, right, a way to describe their physical, emotional, or romantic attachments to other people. There's three primary components: our attraction, who we might be attracted to, our behavior, right, sexual practice, and then identity, which can, be a separate domain for people. But I guess the thing I really want you all to understand, and is important to understand, is that gender identity and sexual orientation are different and not causal. So they occur independent of each other and alongside each other, but one does not cause the other. And I understand that for lots of folks, that is kind of a confusing idea, but I just wanted to have that out there. And then I just want to talk about, we can talk a little about sex development, is the process by which sex characteristics emerge, both primary and secondary. So genitalia, primary. And the reason that we want to talk about sex development is we want to acknowledge folks who we previously would call intersex, but that word is a little bit antiquated at this point, who we would more commonly now call folks who have disorders of sexual development, DSDD. So that is why sex development is in its own category. So again, these are big ideas, and any single thing I'm going to talk about tonight could be its own class. So I'm going very fast. So please, again, stop me or jump in if you need to. If we look at these circles kind of radiating outward, I want to just talk about for a cisgender person, right, whose sex assigned at birth aligns with their gender identity, that there's a comfort there, right? Or there's a kind of like ease to that when your sex assigned at birth and your gender identity align. Gender expression is different. Gender expression is the outward expression of how we live out our gender. So that could be clothes, that could be hair, that could be all those kind of external cues that we have to tell people our gender. This is where this gets a little trickier, Ken. Even for cisgender folks, right, their gender identity might not always align with traditional gender expression. And so gender expression is different than gender identity. We can't always tell someone's gender identity from their gender expression. So what they're wearing, if they're wearing makeup, not wearing makeup, the kind of clothes they're wearing, all these external things doesn't tell us a lot about their gender identity. And then gender perception is how we are seen in the world, how people see our gender. And I think, and those are really the 3 or 4 or 5 concepts that are important to have as we go into the rest of the conversation. But I think it's important to just say that we're going to talk about these all in a little more detail as we go into the talk. Okay. And I will leave this up for the moment. This is just affirming terminology, language that we can use that is, affirming, respectful. It does say intersex on here, also sometimes called differences or disorders of sexual development. I would encourage you to try out differences in sex development, leave intersex behind as a term. But anyway, these are here for you. Let's see. So there are other terms that we can use that are going to be helpful here. So to use a term like transgender people or the transgender community is probably the most, the best way to kind of be as expansive or inclusive as possible. When I talk about the transgender community, I am also including folks who might be non-binary, who might have different kinds of understandings of their gender, but still fall under that bigger umbrella of transgender people or the trans community. I really want to encourage you to use the assigned gender at birth construction. That is the most accurate and most respectful way to talk about trans folks. Everyone's assigned a gender at birth. For some people it works, for some people it doesn't. It's sort of the least pathologizing way to talk about it. I want to encourage you to use the term correct pronouns and not preferred, right? Because someone's pronouns are just their pronouns. They're not preferred, they're just theirs, or they're just the correct ones. I want to discourage you or discourage anybody from using terms like transgendered with the ed at the end. And I know that might sound like, well, what's the big deal about the ed at the end? But it has a um, kind of a medical cast to it, kind of a like you're diagnosing with someone with being transgendered, right? Just the way that sounds. So better to say transgender or transgender people. Let's not say transgenderism, and I don't think anybody here would. But again, these are terms that are used a lot in media and culture, and so I want to really take the opportunity to say that when we talk about transgenderism, that is another way of saying that without meaning to sometimes that there's a disease or kind of innate pathology in there. I want to discourage the biological male or female language because I am not a robot. I am also biological. We all are, unless there are robots here, and that's okay. But when we talk about biological male and female, we are not doing a good enough job to really represent what it is to be trans, to really be accurate about that. And when we talk about biological, it comes too close to me to being non-inclusive of maybe cisgender women who have had a hysterectomy or, other things like that, where even if you're not walking around with your the hormones or the hormone potential you entered the world with, that does not mean you are not biological. So let's use assigned male at birth, assigned female at birth, and not biological male or female. And that's kind of my primer on language, but I'm going to leave this up, okay? So that if folks need to refer to it or keep referring to it, and if you need me to scroll up or down in it, please let me know and I will do that. Just a word about pronouns. I offered my pronouns tonight. I think I did. I think I said they were he, him. I'm so sorry if I forgot to do that, but my pronouns are he and him. And I offer them tonight so you know what's correct for me, but also to acknowledge that someone's pronouns don't always and never have to match their gender expression. So I'm telling you my pronouns are he and him. That might have felt to you like, yeah, that makes sense. But I offer them just as a way to open up space and for us to remember that not everybody's pronouns are going to match their gender identity, what they're most comfortable with. You might feel like your pronouns are obvious or should be, but offering them is a way to acknowledge that other people might not feel that way. Other people might need that invitation or that opportunity to share. I would invite anybody when they're speaking, if you're asking a question, please feel like you can offer your pronouns if you want to, but I would never ask anybody or require anybody to tell me, because without realizing it, right, we could accidentally put somebody on the spot. Somebody who might be thinking about their gender, somebody who might be going through a process with their own pronouns. So I don't want to do that, but I want to invite anyone who's comfortable when they're speaking to offer their pronouns, if you'd like to.
Harvey,
Okay.
can I ask a question on that?
Sure.
Because I know that the Medford group had a fantastic workshop on pronouns, and it really kind of was opened my eyes in different ways. And one of the things was to have your pronouns on your, like I see Donna Raycraft has she, her pronouns are right there on that. I've been in work situations or, where people were, and this is a couple years ago, so maybe it's changed, but it was a required or an expected thing to go around the circle and say what your pronouns are. So that maybe has changed. But I thought it was very interesting to see that by putting your pronouns on, it's an invitation. It makes it more ally safe. I don't know.
Sure. I think it sends a message that you understand that people's pronouns might not just be assumed, right? That people might have the space to express that. I think there's been, and this is some of the challenge, right? Is that things like these conventions can change, like even from a few years ago, people might ask people to share pronouns. I guess my personal opinion is that might be my therapist brain, that we might accidentally be asking people to disclose things they're not ready to disclose, and we might not even know that. And so that's why I invite people to share, but would never kind of make it a compulsory part of if I was going around a circle and people were introducing themselves or something like that. So,
There's a
and I do
question
get
in
asked.
the-
Oh yeah, there's a question in the chat. I'm sorry, Donna.
Yeah, I was just gonna make note of that, that there's a question in the chat.
So I'm going to read the question. Is it kosher to put a place in employment applications asking, not a required section, but an opportunity to share? I think that would be fine if it's not a requirement of a application or I guess the thing to think about is if you're gathering that kind of data, I think people have to understand what you might do with, what you might do with it or, but if it's just an opportunity for people to share a little more about themselves through a job process, that makes sense to me. There might be professionals here who are like, this guy's crazy, don't do that. So if you have a different opinion, please let me know. But no, I think that's a great question. And I would say it's a very reasonable thing to do. And I think, again, people are used to the pronoun conversation enough now that they might be able to understand the context on a job application like that.
Julie's raising her hand.
Yeah. The organization that I used to work for was a nonprofit, and both for the elders we served and for the volunteers, what we asked is, how do you like to refer to yourself? Because some of the
Yes.
elders wanted to be called Mr. So-and-so or Mrs. So-and-so versus their first name, but it was
Very good.
broad enough that if somebody says, I use these pronouns, so without specifically asking, you can just say, how do you
Yep.
prefer, how do you like to be referred to? And that opens it to all of that at the same time.
Well, I love that because people can then choose their own adventure there. If they, like you said, if people want to share about gender, they can, but it's really a much broader question than that too.
And particularly when you're dealing with elders, because some of them really want that respect and they do not want to be
Right.
called by their first name.
No. They want the honorific and
Yep.
should have it if that's what they want. Sure.
And others of us don't turn around when somebody says Miss Kaufman. It's like, who? You want my mom?
Right. Talking to my parents, right? Okay. That's really helpful. Other questions or thoughts before we move along? Okay. So I'm going to just talk a little bit about me, which I'm happy to do, but also is a little bit, as the kids say, cringe. So, but I just want you to know who I am beyond the professional stuff and just who I am in my own life. I think that's important. So here's how I describe myself, kind of in order of importance. Okay. I'm a dad, I'm a partner, I'm a son, I'm a brother, I'm a licensed therapist, I'm a Bravo TV addict. I don't know if anybody else is, but I am. I love J. Crew men's clothing. I spend a lot of money there, whether I should or not. I'm a reader, I'm a writer, and I'm a transgender man. That is not an exhaustive list. And I tried to put it in things that I find most interesting about myself. It's not that I don't find my own gender identity interesting. I've just spent a lot of time thinking about it. And so it's nice, when I sat down to do this a couple of months ago, it was great to think about all the other things that I find about myself to be interesting or that I value. I was assigned female at birth, and I knew for many years that cosmically there had been some kind of glitch in the system. It turns out that while some folks may disagree, it's pretty reasonable to be able to reject any assignment, even our gender assignment, if it's wrong for us. So you don't have to complete any assignment that's not right for you, including gender. Through my life, I've experienced what I now understand to be pretty standard gender dysphoria. I said, I think to Donna from Northampton, I graduated from college in 2002, so you all can do the math. I'm in my very mid 40s. So I grew up mostly in the 90s. And for those of you who remember, that this was not something that was talked about. It was not something that was talked about the way it is now. And so were I a 15-year-old in 2024, I think I would know what I had been experiencing was gender dysphoria, but because it was like 1996, I didn't. Until I went to school at age 5, I lived pretty much as a boy. And my understanding of myself was entirely male. And my body mostly conformed to this, except for, one big exception, my, primary anatomy, primary sex anatomy. And that's not really relevant to 5-year-olds anyway, right? I mean, you go to the bathroom, that's kind of the extent of it. Otherwise, you have a lot of plausible deniability around who you are and who you can be. I happen to have a twin brother assigned male at birth. That was the correct assignment for him. And so I kind of just was like, yeah, we're two guys running around here doing stuff, being together all the time. And it didn't occur to me that that was incorrect, you know. I spent a lot of time running around without a shirt. I spent a lot of time outside just doing these things that felt very natural to me. And were okay, I think, because my parents were and are pretty open, but also okay because I hadn't gone to school yet and hadn't hit that brick wall of what happens at school, which is when we learn the rules of gender. When I did go to school, I think that's when I realized, like, okay, the jig's up here, right? I was called a tomboy. I was called a lot of things. Tomboy might have been the nicest, but you know, that I was allowed to be a tomboy, you know, for a while. That was permissible and okay. I think the expectation was that around puberty, I would sort of figure it out and start to dress more femininely, or, you know, kind of be more comfortable with my assigned gender at birth. There were times in my life, you know, through my adolescence and early 20s where I did conform to my assigned gender at birth, like that, those kind of moments where I was like, all right, I'll try this, you know, I'll dress up for a dance, or I'll get really fancy for something. And in those moments, I was the most uncomfortable, right, than I've ever been. But I received the most positive feedback from family and friends. That was when people were like, you look, you know, you look awesome, great job. You look, you know, you should do this all the time. You should always wear makeup. You should, I mean, fill in the blank, you can imagine. I was very uncomfortable, but they were very excited. And that was really hard to reconcile, because what I started to realize was, in order to make myself more comfortable, I'm going to have to make everybody else uncomfortable, at least temporarily, right? And kind of upset the apple cart here. In college, so for those of you who hadn't signed on, I went to Smith College in Northampton, so historically all women's college. Now I think it would describe itself that way too, but also is inclusive of trans folks, which is great, trans students. And that was the first time I met transgender people, people who were in some phase of medical transition. And that kind of blew my mind apart and was really exciting and really scary at the same time. I did start to think about whether transition was something I wanted to do in my early 20s. The answer was yes, I definitely did, but it felt to me like wanting to fly to the moon or live in Tokyo. Sure, those things would be great, and I'd probably love it, and I'd probably be a lot happier. But how do you actually get to the moon? How do you actually move to Tokyo? I had no idea. So that was stressful. So if we fast forward a little bit in time, I've been married to my partner, Melissa, for 17 years in June, this June, so just next month. We have 11-year-old twins. In new situations, I imagine that people might interpret our family as like a cisgender straight mom and a cisgender straight dad. The 2.5 kids, really 2 kids, and dog situation. That, you know, that's okay. I'm sharing this with you tonight in the hopes that it normalizes what it means to be transgender in the world. But it's also important to know that when and how I disclose this is really a moving target. It's not the same in every situation. There's a lot of factors that depend on whether I might disclose. I'm really comfortable doing it tonight. I feel very safe doing it tonight, but it's not always the case. It's my matrix, and how I decide this is what's best for the kids, what's best for our kids. What's the safest and what's most comfortable for all 4 of us. And again, that changes. And I don't know if any of you have twins or just multiple kids. Like sometimes one kid wants one thing, sometimes the other wants another, and we try our best to do what everybody needs. So one thing that's helpful to understand as I go into this next part is that this may sound reductive, but we all have a gender identity, right? We all have a gender identity. Trans people's gender identity tends to be kind of examined, scrutinized, looked at more, but we all have a gender identity. And so we all have these experiences of gender expression, clothes, all of those things, what works for us, what doesn't. But again, it's important to remember that. we meet people and move through the world, and we really know very little about people's gender history, surgical status, or their bodies under their clothes, right? We don't, that just doesn't to me ever feel like it's relevant unless you're at your doctor, maybe with your partner in intimate situations. But other than that, there's not a whole lot of time when we're meeting people and encountering them, and we need to know, well, have you had top surgery, or what's the situation? What were you assigned at birth? I would just offer to you all tonight, it's not super relevant, and sometimes people will share it, but it's not always required, right, to get to know somebody. All right. So I want to talk a little bit about trans people in the world, and I want to start, let me see if I can just do this. Can you all see this now, the history of left-handedness? Okay,
Yes.
so I want to talk about this graph, which came from Twitter, which, the best and the worst things come from Twitter. But it's important to me to talk about this because it's a helpful illustration. So what we have here is the history of left-handedness in the United States up till about 1918 or 1919. Being left-handed was basically criminalized. I would say it fell short of like people going to jail. But if somebody was born left-handed, a child was born left-handed, it was expected that the parents and the school would convert them, let's say, right? They would be hit or beaten if they were using their left hand. They were discouraged from using their left hand in all ways. It was just thought that it was better to be right-handed. In certain Asian cultures and certain parts of the world, your left hand is seen as sort of the unholy or not okay hand, right? Some people, some religions, some things like that would see it as the sign of the devil. But right around 1918, we in the United States kind of realized maybe this isn't okay to do. And we stopped criminalizing it. We stopped trying to convert people. We stopped saying it's better to be right-handed. And as you can see from the graph, or as I'll explain, what happened after that is that the rate of people identifying and disclosing that they're left-handed shot up, right? So much so that by 2000, it was at 12% of the population, just shy of 12% of the population. And this metaphor is one that I use a lot because this is what's happened with trans people, right? It's not that we went from no left-handed people to 1 million left-handed people. It's that once being left-handed was decriminalized, people could talk about being left-handed. People could share their story. People could just be left-handed in the world and not expect that people would try to talk them out of it or beat it out of them in the case of children and public schools. And I share this for a number of reasons. One is that there have always been trans people in the world. There will always be trans people in the world. It might feel from some vantage points like there are more trans people, and certainly it could feel like, oh, there's so many more trans kids. That's what I hear a lot. Why are so many more kids coming out? Why are there so many kids who say they're non-binary? And to that, I just say, let's look at the history of left-handedness. It's not that there are more trans people. It's that we know more now than we did. I'm not saying we're doing better all the time, but in general, we know more now than we did. And so that's a really useful construction for me. My work and my professional work, but it's certainly a personal mission of mine too, a mission statement, is to support and help trans kids and their families, not only to accept themselves, but to celebrate who they are and to feel excited about who they are. Often youth come to me because their parents are worried about them. They're anxious. The youth are anxious, depressed, maybe withdrawn, not wanting to leave the house, lots of things, right? What I see over and over is that when trans youth, any youth, but when trans youth are supported in being who they are, they begin to feel better pretty quickly. I joke with folks that in terms of being a therapist, this is like shooting at the broadside of a barn because the treatment is so effective. To be gender affirmative is so effective for folks that kids start to feel better right away. And that is something that it can seem like a very complex process, but it's really not. But families can struggle to accept that their child is not cisgender or not heterosexual, one of those two. 99% of the time, I see that struggle being rooted in worry about the child's safety, right? Is my child going to be safe? I think that's the question we all ask ourselves every day, all day. I do. I mean, maybe I'm speaking for myself. And so that fear about safety and harm is one that parents are really struggling with. My role is to help parents understand that this is a change process for them, the parents, but often not for their child, right? Their child has known this about themselves, usually for, I think research tells us, a year plus, by the time they might disclose it to family, close family like parents, caregivers. So it's not new information for the child. And sometimes kids come into my office and they're like, all right, I'm ready to do this and this and this. Let's get it going. And the parents are like, wait a minute, I just found out about this a week ago, and so there's that mismatch in what the parents and children are experiencing. Sorry, I lost my spot. Okay. One thing I hear a lot from parents or questions from parents is, what if they change their mind, right? What if they say to me in 5 years, how could you let me go on hormones? How could you let me do this or that? And to that, I say, there is no way to tell the future. That is true. We can't 100% predict that, this will be the case ongoing. But part of my work is to assess what the right thing is for the child and the youth. And the research and the data we have is that kids don't change their mind. That doesn't really happen. And in the cases when it does, it's generally because of a lack of family support, or lack of resources, access to the actual medicine, right? Actually gender affirming medical care. Any questions from right here as we talk about this? Yes, I see somebody. I'm just gonna.
You indicate is there a waiting period from the time a child has expressed their desire to trans? Is there a psychological period that they must go through before any physical changes occur, in case, like you said, someone could change their mind? I know that anybody can change their mind anytime, any place.
Sure.
But is it more beneficial to have the child wait for a particular period of time to make sure that they're comfortable with that?
So
Rather than
that's
they go, okay, let's do it.
Right. That's a great question. The standard of care through about 2012 was what we call watchful waiting, which is what you're describing, which is what if we just sort of see what happens through adolescence, and then when a kid is old enough at 18, which I think we all know 18 is a legal designation of adulthood, not necessarily a developmental one. But anyway, the watchful waiting was the standard. The reason that it changed is because the psychological outcomes were so bad. I mean, kids were struggling so much with anxiety, depression, dysphoria, suicidality. When we shifted that to say that there is psychological assessment that needs to happen, there is work with the family, there is a period of discernment, right? But it doesn't need to take years and years. It can take as long as it needs to take. There's no minimum, there's no maximum. Kids began to evidence really much, much, much better mental health outcomes. So what I would say to your question is there's no minimum time. It depends on a lot of factors. It depends on the kiddo and what they're saying. Depends on the ability of the family to support them. Lots of factors like that. But we don't do watchful waiting anymore. We don't say, let's wait for a long time, like years and years, to see if you're going to change your mind, because what happens then is kids really begin to suffer.
Hi.
Other questions? Thank you for that one.
Well, this one might be piggybacking on that a little bit. It was raised to me and I wasn't sure how to answer it. In Zonta, as you know, one of the things we're advocating for is child marriage not to be allowed until the child is 18, and for the for those rights. But I don't know how. So the question was, how do we advocate for not marrying until 18 and yet look at when is the right time for a child under 18 to make this decision?
I'm going to give you my unabridged answer. Is that okay?
Yeah.
Okay. I think that question is really flawed. And I'll tell you why. I mean, I don't think people mean for it to be, because I've heard this a lot. We just passed this in New Hampshire last week. So there's been a lot of conversation about, we outlawed child marriage. I think Sununa will sign it. So anyway, so this has been coming up a lot for me. So the first thing I would say is that marriage is not healthcare, right? Everybody has the right, including children, to developmentally appropriate healthcare. So that's my first answer. My second answer is that any medical gender affirming care that occurs under 18 requires parental permission. It can't go on without parental or caregiver permission. This is part of what has been so frightening about child marriage, is that it doesn't require parental permission. At least in New Hampshire. Donna Rakoff, can you correct me if I'm wrong?
You're right.
Yeah. The third thing is it conflates a very adult enterprise, marriage, with children, and those are not the same thing. So children being able to get married and enter into an adult convention like marriage, requiring adult decisions, behavior, all of those things at 16 is completely it's damaging, and we know the stories, right? We know the stories of damage that have occurred. But children accessing healthcare with the support of their parents, evidence-based healthcare, is not an adult enterprise. It's just about being a kid. So those are all my answers.
I'm confused.
Yeah.
In terms of hormonal replacement therapy, are you saying
Yep.
under 18, a person needs parental permission? Did you say that?
Yes, they do. No, they do. They do.
Is that
Yep.
per state, or is that a federal, or?
No, it's not federal. There are two states, Oregon and Massachusetts, that have what we call the mature minor carve out, which is at 16. If someone can be designated a mature minor, like maybe they're emancipated from their families, or maybe there's other situations like that, they would have to go to court, and a judge could intervene and say, yes, they can make a decision for themselves. But otherwise, every person under 18 who wants to access gender affirming medical care has to do that in conjunction with parental permission. It can't happen without parental permission and psychological assessment and a number of other safeguards as well.
So a parent could really put a kibosh on this.
You're right. And sometimes that happens. They might say, well, I don't want to give you permission until you're 18. Or they might say, I'm not comfortable, or, whatever, I need more time. And that does happen. And what happens in those cases is kids' mental health, the mental health of the client tends to suffer significantly.
Harvey, do you see that happening in divorce cases that are contentious, that one parent might withhold permission just to get back at the other parent at the expense of the child?
Right. I've seen that. I've seen in a divorce, divorce or separation, one parent is on board, the other parent isn't, and there's kind of no way to get them to figure out how to do it. And usually those cases go to court, go to family court for some kind of for the judge to essentially rule. I've seen parents who are in a intact marriage, co-parents struggle to get on the same page. So this is a big, as you're all, I think, pointing out in your own ways, this is a huge decision, and it's very, very challenging. What I often say to parents is, if X had type 1 diabetes, right, which is a progressive and harmful thing, we know insulin is the best treatment for it. We know insulin is life-saving. That is what, HRT is for kids with gender dysphoria. Julie, I think, has a question at the top there.
So when kids start treatment I'm assuming we're only talking about hormonal and not surgical interventions under 18. Is that correct?
Right. That's correct. Yep.
And
Yep.
is it in theory reversible if they stop taking the hormones?
So, well, I guess the one exception I would say to surgery is that sometimes transmasculine clients, so clients who were assigned male at birth and have a chest that they are very uncomfortable with, can get top surgery maybe 17 or so, right? Just before turning 18. So that would be the one
Okay.
thing. I'm sorry. So then your other question was in
So the
terms of
question
what's
is, if
reversed.
they stop
Yep.
taking the hormones,
Right.
does that
Right.
basically, I don't know if you can say could totally reverse it, but it stops that
Right.
at that point, and their hormones at birth take over again. Is that correct?
Yeah, for the most part, there are some things with testosterone that are permanent. Facial hair and voice, or I think body hair in general is permanent with testosterone. I know it is actually, and voice. With estrogen, there are fewer things that are permanent,
Okay.
and generally with estrogen, things will return. And again, that very rarely happens, but that is the case. Yeah, if a kiddo were to say, I'm ready to go back, or I want to go back, that does happen, or that can happen for sure.
Or if they're forced to by a parent.
Right. That's the other thing. If it's withheld, right, they will return to their assigned hormones at birth, I guess we could say. But that can be a really uncomfortable experience, as you
Oh,
can
yeah,
imagine.
but I just
Yeah, you're right.
one of
You're
those
right.
nosy questions.
No, that's a great question. That's helpful to me.
Right, but you can't ask that of certain friends. That's why I say
Oh, sure. Yeah, no, please.
it's a nosy question, but a good question.
No. Those are the questions I love, actually.
Right.
So, okay, other questions before I move on a little bit? Okay, and so we've talked about the history of left-handedness. There's one more handout or visual that I want to talk about, or I want to show you. Here it is. So this is the US Trans Survey. I think it had just come out like a few weeks before I did this in March, Donna Raycraft. So I'm doing it now because I have a little more facility with it. So this survey was given in 2022, early insights released just a few months ago. And so I just want to show this to everybody. So the sample was 92,000 trans people. I'm going to read it across. 94% of respondents who lived at least some of the time in a different gender than the one they were assigned at birth reported that they were either a lot more satisfied, 79%, or a little more satisfied, 15% with their life. 98% of respondents who are currently receiving hormone treatment reported that receiving hormones for their gender identity and transition made them either a lot more satisfied, 84%, or a little more satisfied, 14%. And then finally, nearly half, 47% of respondents had thought about moving to another state because their state government considered or passed laws that target transgender people for unequal treatment, such as banning access to bathrooms, healthcare, or sports. And 5% had actually moved out of state because of such action. So if you are not a research methods nerd like I am, I just want to point out and underline that, first of all, the sample size is remarkable, right? 92,000 people to answer a survey is remarkable. And then these numbers are remarkable. So for, 94% of respondents said that either at 79% of those 94 is how I interpret that, a lot more satisfied with their life after HRT. That's just unbelievable to me. I mean, I believe it because I live it, but it's just such an amazing response rate. And then 98% of people reporting that hormones made their gender identity and transition, a lot more satisfied, 84% of that 98. And that's remarkable. And what's important to me about the survey is that this is trans people, right? These are trans people saying this about themselves and their own lives. It's not politicians or other folks saying it about us. It's us saying it about us. And I think this goes back to the idea of being affirmative. When we believe people, when they tell us who they are, when they tell us about our experience or their experience, that's a really, really vital way to support trans people and support really anybody. But again, these numbers are not, it's not a close call. Let's say it's very, very remarkable. And I just want to show you one other thing, excuse me. So then they broke it down if people want to look more at this. And again, this is in the resource list. There's a lot about work and what workplaces can do to be more inclusive. And a lot more about the kind of breakdown of how people are reporting that life satisfaction after they're able to start hormones. And it is true that this survey was 18 folks 18 and older, at least. You had to be 18 to answer it. It's not specifically about kids, but we have data too that tells us that kids feel remarkably better when they're able to start medical transition. So all of that is really important. I just want to, oh, I'm so sorry. Go ahead.
My question has to do with I think I had the right wording, sexual reconstruction. Trans, okay. I don't know that much about insurance, but my question would be trans people who are unable to have sexual reconstruction. Mm-hmm. Anybody looked at their satisfaction, happiness, statistics?
That's a great question. You mean if somebody can't get what we call colloquially bottom surgery or
yeah.
Okay. That is a great question. I think that there is more variance there than we might imagine. I think for some trans people, bottom surgery doesn't feel essential, right? Like it's just not a huge part of what is uncomfortable for them. But for some trans folks, it is. And so I do think there's information in here about that. And your point about insurance is a really good one, because some people just literally are not able to access it, you know, because the cost is astronomical and their insurance might not cover it. And that's primarily people on public insurances, state insurances. Most commercial private insurances do cover all trans-related care, and that's because of Obamacare. So there was a big shift in this circa 2012 when Obamacare was. Mm-hmm.
I'm not sure what you're saying about Obamacare. Yes or no?
So when Obamacare was passed in 2012, I think it was 2012, it included protections and rules that said that any marketplace insurance, any Obamacare insurance had to cover gender-related surgery, medical care, things like that. And so it opened up a world of access to people. So that's, 12, 13 years ago. But there's been a lot of restrictions and rollbacks in the last 5 or 7 years that I think we're probably all aware of. And so there are people living in certain states who can't access the care that they need at the same rate they would have been able to 5 or 8 years ago. So there's information about that in the download, the breakdown of the survey here.
Okay. Yeah. And people who don't have, folks who don't, the whole issue of intimacy, is that how big a factor is that?
I think it depends on the person. I think intimacy is, of course, specific to the person and the relationships they're in. But it is the case that not everybody needs or requires, what we call bottom surgery to feel comfortable, with intimacy. That's really a person by person decision. Again, our genitals, all of our genitals, right, are really a very small part of our day-to-day in terms of how we interact with other people, outside of partnerships and doctors and things like that. And so for a lot of folks, it's not an enormous source of dysphoria. So again, I think that's case to case.
Thank you.
Mm-hmm. Absolutely. Other questions?
Harvey, I have well, first of all, let me tell you that I don't think I've ever been in a room with you, whether it's a real room or a Zoom room, that I haven't learned something. So I thank you very much. And I appreciate your generosity, especially in sharing with us. This is a little bit of a different question. Stephanie and I are in our jobs in Zonta for the last 2 years has been paying attention to membership. And since our district is the smallest one in the world, in the universe, actually, we're always trying to increase our membership. And I'm wondering how we can be inviting and inclusive to LGBTQ trans without seeming as if we're recruiting for quota or something. Do you know what
I get it. I do. I understand. And so you're talking, I think what you're asking, Donna, is about language that signifies or signals to trans women in particular that they are invited, included in Zonta. And so off the top of my head, so again, my experiences within all women's college, and in all women's college that is inclusive of trans women, and also people who are assigned female at birth and realized after they arrived at Smith that that was not correct. So anyway, there's language that basically, I'm saying basically there's language we can steal. I mean, in an appropriate way, that's out there for organizations that are historically all women's or historically single gender. And I'm happy to help you do that. Just don't tell on me, but it's all out there, and it's all available.
That's a great
I think
idea.
the other thing
Good idea
that
to steal from Smith.
I think just all women, historically all women, single gender institutions, just because they've figured out this language and use it in admissions. So that's one thing, Don, and I can send you some stuff. So the language is one thing. And then also I think and I was at the Zonta meeting in March, this is already there, that the language is already inclusive, it's already broad, it's already focused on, equity and diversity. So a lot of it is already built in. And maybe it's just at that point where somebody's deciding, is this something I want to, go, pursue or be part of? That's really where you're looking for some help. Sounds like.
Thank you, Harvey.
Yeah. I am aware of time, but all of our time, and it always goes by too fast when we get to do things like this. But in closing, what I would say is that I think we know this: patriarchy serves no one, even those who benefit from it, right? So even men and trans men, cis men, I certainly at moments I think probably benefit from some privilege that is out there, but it doesn't serve me and it doesn't serve anybody. And I really see that as the work of Zonta, is to be one of those organizations that is slowly but surely dismantling the patriarchy and working toward real equity right outside of that framework. And I so appreciate that. Gender affirming care, reproductive rights, the right to self-determination in our bodies, for our bodies, that's really the link here, right? To me, that is what all this, the ways that all of these struggles are wrapped around one another, is that if we're talking about people's right to bodily autonomy in terms of abortion, if we're talking about it in terms of, children not being compelled into marriage and coerced into marriage, if we're talking about gender affirming care, all of that is the same fight. So I so appreciate everything you're doing, and just glad to be part of it in whatever way I can. And Julie, I see that you have a question.
Yeah, it's sort of a question and an answer to
Sure.
Donna. I teach self-defense for women, and we're advertising a class now, and we are wording it. We used to say anyone who identifies as female. We've now, just for the latest one, changed it to female presenting people. Because somebody could identify as, gender fluid, but presents as a female, which makes them just as vulnerable to attack as somebody who is cisgender female. So it's your that final outer layer of how you present yourself that makes you most vulnerable to attack. So we're trying to be inclusive in that way.
Thanks, Julie. And thank you to you, Harvey. I so appreciate everything that you've shared with us tonight.
Yeah.
And I look forward to our sharing all of the written material that you have that we will put on our website. So the District 1 website will have a lot that you can just take from.
Yeah, thank you. Thank you all. And just Donna, if it's easier, I can PDF this enormous Google Doc. It's like the inside of my brain.
That'd be
Here,
great.
I can PDF it. The links will still be live, but then it won't be editable. And so there's no chance of it kind of changing. So I'll send you that one, and maybe that's the best one to share. Sure.
Yeah, thank you, Harvey.
Yeah, absolutely. I
Thank you.
just want to make sure.
Thank you so much.
Excellent.
I'm
Thank
sorry to
you.
interrupt.
Yeah.
This
No,
was
thank you.
amazing.
Thank you all for coming.
you so
Yeah, I
much.
really appreciate it.
I appreciate you
Thank you
creating
all.
such a safe space for us. I do have a question
Thank
for you,
you.
just along safe space lines, and you don't have to answer
Sure.
if you don't want to. But did you get
No,
to
I'm
pick
happy
your
to.
own name? Did you pick your own name?
I did pick my own name. Yeah, my
It's a
name is my
really good
mom's.
one.
Thank you. Yeah, it's my family name. I hate the term name, so it's her family name.
Yeah.
So that's how I picked it.
Sorry.
That's excellent. It's a really good one.
Yeah.
I like it. Very,
Thank you. I
very
really appreciate
informative.
that.
I learned so much. I'm glad it's recorded. I definitely would like access to the recording